So today we have Rover with us, and he is a canine, male castrated canine. So I'm going to explain the importance of our master problem list. Alright, so we have master problem lists to tell us all of the history of this animal, and they are super important because it also allows us to know, oh, does this animal have any allergies to anything? What kind of medications this animal is on? What kind of surgeries or issues or diseases this animal may have had in its lifetime. So if we look at my list here, it tells us that Rover is vaccinated with his rabies, distemper, lepto, and his Lyme vaccine, so he's all up to date with those. It tells us that he's currently on Perfecto and Interceptor Plus, which is a heartworm and flea medication. It tells us that he has an allergy to flea saliva and environmental factors. It also tells us that in his past, he had a crypt orchid neuter, so that meant one of his testicles did not descend, and he had that done to him. He also had a foreign body surgery, and he also came in back in June of 2021 for excessive itching and biting, which is how we figured out he had the flea allergy and the environmental allergy as well. So, who is responsible for this? Everybody in the practice, like the vets and technicians, are responsible for keeping this up to date. It's very important to keep it up to date so we can all know about Rover and about his physical status and history. We should be able to find the master problem list in his file and patient records. It should be in there and updated every time he comes in for an annual exam or surgery or checkup. And the master problem list also gives all of the information of the animal and the owner. So you'll be able to look at this and refer to this if you need to contact the owner for anything, or if you need to know anything about him as well. And that is a master problem list.
Alright guys, so today we're going to go over the importance and why we have consent forms. So whenever a patient comes in for any type of procedure or anything that has to get done to them, we need the owner to sign a consent form. Basically, the consent form is just having the owner acknowledge the fact of why the patient is coming in. Anything else is like what we're going to do to them that day. And just making sure that they're aware of any type of complications that can occur. So for instance, if Rover here was coming in for a surgery, basically just, acknowledging what the surgery is and all the risk and stuff that come with him going under anesthesia, making sure that in the case that something would happen to Rover, that the hospital is not liable for anything that happens. The consent form is also a really great way to have quick contact information. So by having the owner put their contact info down and even an emergency number, it makes it really easy for us in case something did happen, that we can either contact the owner or an emergency contact. The owner would get this from most likely the receptionist or someone at the hospital. It is important that the owner is the one that signs this and not somebody else. A couple things to pay close attention to is just some of the stuff that's in the fine print, being that the owner comply with any pre-surgery requirements like fasting and stuff like that, and that the owner once again understands the risk of going under anesthesia for a procedure.
So today we're going to talk about the discharge form. The discharge form provides the client with all information presented to them at the clinic. Oftentimes clients will forget information presented to them during their initial visit, so it's good to have a whole sheet with every piece of information they'll need once they get home. You should pay close attention to the diagnosis and treatment section so the patients fully understand the diagnosis presented to them. Treatment should also be pretty clear to make sure they know how often the medication is given, how many times a day, and for how long. You should also pay attention to the exercise instructions to make sure clients know whether their dogs or cats should be kept on a leash, or they can go free range, or what they should do. You should also present them with a recheck date so we can have them back with any problems they may have, because oftentimes they won't call in to create a new day to come in, so this should be provided with them. We also want to make sure the veterinarian signs the form fully stating that this is what he diagnosed them with and what he wants them treated with, and you want the client to sign to make sure they fully understand what's happening with their pet. Additionally, the receptionists are responsible for this form and the veterinarian. Oftentimes the clients will ask receptionists on their way out any questions they may have that they didn't ask the veterinarian, and the veterinarian himself or herself is also responsible for any information that is provided on the sheet.